Dr. Puneeta Sharma is the Chair for Medical Specialties and Director for Care Experience for Valley Medical Group. She is board certified in internal medicine and hospice and palliative care. Dr. Jack Annunziato is board certified in physical medicine and rehabilitation. Christine Trent, BSN RN, is the Transitions Coordinator, Care Coordination Department. And now I'd like to introduce Dr. Sharma.
Thank you, Colette. Good evening, everyone. It's my pleasure to be here, and we're very excited to let you know about the program that we have put in place at Valley to take care of patients who are experiencing residual symptoms after COVID-19 infection. So, initially when we started dealing with COVID-19, saw, I think, our first patients come in. This was in the earlier part of 2020. At that point in time, little did we know as to how the disease would carry itself and what would be the long-term effects, if any, once somebody caught this infection. Data started emerging. There were reports from all over the world regarding patients who, after testing positive for COVID-19 and suffering the acute phase of the disease, were unable to revert to their normal activities and normal daily routines, and they continued to exhibit persistent symptoms. So earliest information actually came out of an Italian study, which was published in JAMA, which suggested that people, despite after suffering from the acute infection, they had persistent symptoms, which lasted over a period of time. And that's when the term long COVID was coined. So what is long COVID? Long COVID is anybody who has experienced an acute COVID-19 infection and has persistent symptoms that develop during or after COVID-19 and continue for greater than 4 weeks and are not explained by an alternative diagnosis. So how does one experience these symptoms? Like, what's the reasoning behind this? So the symptoms are there as a result of dysfunctioning of your immune system. What happens is during COVID-19 infection, your immune system is really, really working hard. It's really, really active, and it goes into a complete frenzy. There is a lot of viral replication that's happening. And as a result of all of that inflammation, there can be residual organ damage from the initial infection. Of course, as a result of the treatments and as a result of the active infection itself, there can be unmasking of some underlying comorbidities. So for example, if you got steroids, and you were on the cusp of developing diabetes, now, you may show up that your blood sugars are higher. Symptoms may also be related to, post-hospital or ICU syndromes, anxiety, depression, post-traumatic stress disorder. All these things are pretty common. So what are some of the symptoms that we saw in patients who were continuing to experience persistent symptoms after the initial acute infection? Tiredness, fatigue, very, very common. And that's why we have Dr. Annunziato, who will tell us about some of the techniques and some of the measures that can be done to mitigate the effects and to get to somewhat of a normal routine and life. Shortness of breath. Our pulmonary folks have been very, very busy in seeing these patients. Chest discomfort, cough, loss of smell and taste, joint pains, muscle pains, inability to sleep, psychological symptoms, like I mentioned before, anxiety, depression, post-traumatic stress disorder, even grief. I mean, some patients and families lost their loved ones. And all of this has a huge impact on quality of life. So realizing that, there was a need in the community to deal with these issues, Valley put in a Care After COVID program, which is a multidisciplinary program that provides specialized care and support that's needed to address the long-term symptoms and help individuals make a recovery. I'd like to now turn it over to Christine Trent, who's going to walk us through how the program works. So Christine, over to you.
Thanks, Dr. Sharma. So actually, let me just explain how things work when you call in. It's a dedicated phone line. So if I don't answer the phone, please feel free to leave a message and I will get back to you. I start with gathering some information. We talk about your experience. We go through some of the actions you may have already taken, any doctor visits, tests, etc. We talk about what's going on now current symptoms, what you're experiencing, your side effects, and we try to focus on what's really troubling you the most. Then I recommend, with our team of physicians that are on this Care After COVID pathway, I recommend appropriate specialties for you, and we try to decide on a plan. It is a very collaborative effort. You may need more than one appointment. You may need to go to one or two physicians. And then we have an access and navigation team who help me to coordinate those visits with your schedule to make any appointments. So it's real time. We can do it all right before you hang up the phone with me. So that's pretty much what I do when I get you on the phone. The other thing I want to mention is that we have a support group. It's every other Thursday. Thursday, October 6th, I believe it is the next date. So I have here on the screen the contact information. And if you do feel that you'd love to talk to somebody about what you've been going through and you want some support, we have 2 licensed social workers who do this conversations with you and anyone else who calls in. So if you just contact them, they'll give you a call back, they send you a link, and you can be part of the meetings. So that's what I do.
Thank you, Susan. Thank you, Christine. Thank you for your informative conversation. And I also wanted to let you know that, the interdisciplinary team comprises of our rehab specialist, Dr. Annunziato, who's going to be talking to you just now in a few seconds. And then we also have cardiologists on our team. We have a pulmonologist on our team. We have ENT specialists. We have arrangements with Christian Health to refer you to their support groups and our support groups, and refer you to behavioral health specialist if there is a need. So it's really a collaborative approach and a true multidisciplinary approach based on the symptoms that you may be experiencing. So over to you, Dr. Annunziato, to talk about how you are helping one of the most common symptom of fatigue and joint pains and muscle aches.
Sure, thank you. And good evening, everybody. And thank you for taking the time to sit back and listen to us. And hopefully we can give you some information and answer some questions and kind of help you progress and take part in your healing or the healing of a loved one. So as Dr. Sharma and Dr. Trent and Colette mentioned, my name is Jack Annunziato, and I am a physical medicine and rehabilitation specialist here at Valley. My focus is in outpatient physical medicine rehab. So I see people in a clinic. A lot of people don't know what physical medicine rehab is, because it's also called physiatry, which is a little different than psychiatry. And so part of what I explain to my patients is that I'm a function doctor first and foremost. I see patients for all sorts of issues that need rehabilitation and recovery. That could be back and neck pain, that could be joint pain. I take care of people who have different disabilities, and that could be patients with an amputation or have difficulty walking, all sorts of injuries and disabilities, post-stroke, post-fall, post-compression fracture. So I'm in the business of rehab, whatever the condition is. And it just so happens that 2020 and 2021, the condition is COVID-19. And so let me explain to you what happens after Christine makes your appointment with me and you come to the office. So we start off by taking a history. I ask you a very broad set of questions to get a better understanding of what your symptoms were, how they progressed, what got better, what didn't get better, and what you feel like is limiting your quality of life. Then we go into a physical exam, and I'm going to kind of check your strength, your sensation, your reflexes. For those of you who have issues with the brain fog or the confusion or the forgetfulness, we do a neurocognitive battery where I ask you a bunch of questions, not designed to make you feel self-conscious or threatened, but more so to get a better understanding of the things that limit you, whether that's poor attention or concentration or even short-term recall or memory. So it's a thorough battery of questions, physical exam maneuvers, and trying to get a better understanding of what specific issues had COVID-19 impacted your life? And maybe part of it is also what things did you have before that play a role in why your recovery is delayed. A great example is today. I had one today. A patient had COVID-19, also is suffering from cancer and is an active cancer treatment patient. So how does the role of her cancer treatments and the cancer disease itself impact, what's the fatigue from? Is it the cancer? Is it the COVID? So we kind of manage you as an individual. And so I'm going to go through the list of things that I typically see in the office. And first and foremost, I think the number one thing that people complain to me about is fatigue and excessive tiredness. This is by far everyone's number one thing. Sometimes even if they don't have COVID, I'm a little tired and stressed out. And so there is some decent literature out there nowadays, because we are now at almost 2 years, scary enough, about what to do. And the American Academy of PM&R, my overarching society, put out a position statement specifically on fatigue, because that is our number one thing. And so one of the things that we stress first and foremost is to make sure that we have are setting ourselves in what are called a positive lifestyle environment. And what that means is this: are you drinking enough water? The current recommendation is you're drinking at least 80 ounces of water a day. So we want to make sure you're not dehydrated. Supplementing your diet with vitamin D, B12, C, and zinc. D is separate, but everything else you could probably get in a multivitamin, or just making sure that you're eating a well-balanced diet. We talk about adequate sleep. And it's not just the length of time that you're in bed. It's making sure that, it's screens down, it's lights dimmed, the alarm clock is turned the other direction so you don't see the light in your eyes, eliminating distractions if possible to promote good quality sleep. And then it's building endurance. So we talk a lot about making sure, so part of the fatigue is like, I'll take an example. I had a patient yesterday. They're a teacher, they're in school, and by about 1 o'clock, they're exhausted and they can't keep their eyes up to teach their kids, and they're running out of energy. And so we have to talk about different strategies for how they basically what we're calling is energy pacing. It's almost like if you have a gas tank, and whether you do a taxing mental activity or a taxing physical activity, it uses the same gas tank. And so part of understanding of this, of dealing with fatigue, is knowing what tasks ahead of you are going to use that energy most, and allowing yourself, working with your family members, your support group, even your coworkers and colleagues, letting people know, I can only do X amount of activity during a day, or, patient, that same teacher patient, grocery shopping is going to be a Friday night thing. And then I am not doing anything Saturday morning because I am going to be exhausted. And that is a conversation that, we try to have, because we know that going out in the community, running the groceries and errands is an exhausting thing. And we're going to need a light day the next day. So we talk about energy pacing. There are some medications that are currently being trialed in specific populations for the fatigue. That is a one-on-one decision to have with your physician, because a lot of them have side effects or are maybe inappropriate based on your other health conditions. But that's a conversation that we have. I think after the fatigue, the second thing that I have is the brain fog. And brain fog means a lot of different things to a lot of different people. So we try to tease it out. Some people cannot remember the things that they did earlier in the day. A lot of people are having this word finding problem where they can't remember the name, and they do this kind of circumlocution, which basically what that means is, this is a pen, but they can't remember the word pen. And they go, give me that thing that writes in blue ink. They know what it is, they're trying to convey it, but they don't have the word pen in their mouth for some reason. Some people have an inability to concentrate. And so, they can be doing one task and they can do it well, but if you start distracting them, oh, I have a question, or the phone rings, you'll lose your train of thought almost instantly. And there's an attention concentration issue at hand. And sometimes it's an endurance of concentration. You're making a recipe, you know the recipe from scratch, you did the eggs, you did the milk, you did the butter, you did all the ingredients, and all of a sudden you forgot the last one. Like you lost it at the end. So there are these different things that all kind of fall under encompassing brain fog. And what do? Again, we go back to making sure we have a good environment. We're setting ourselves up with good habits. But in addition to kind of teasing that out, one of the resources that we utilize here at Valley is cognitive therapy. And we have a bunch of speech language pathologists at Valley who we refer to, who will take the time to go through the different assets of this brain fog, the attention, the concentration, the memory, the focus. And we'll start to give you activities at home and also in the session to work on them, to better yourself. And there are strategies to keep you on track. A lot of it is like list making, making sure you have a checklist throughout the day, keeping track of everything, sending yourself reminders, using technology to your advantage, putting alerts on your phone or on your watch and stuff like that. So that's another big thing. Smell and taste. I get a lot of, oh my God, I can't smell anymore. I can't taste the foods that I want to do. I can taste texture, but I can't taste what the food I'm feeding. I don't enjoy it anymore. Another weird one I get is phantom smells. I don't know how many people are listening, but I would say maybe once every 2 weeks, I get somebody who says, I smell cigarettes all the time. I have no idea why, but I smell them. Or I smell gasoline, or something is burning and I don't understand why I smell it. Interestingly, the best data that we have are from boxers, people who get punched in the face, in the nose, and have had kind of the nerves around the nose damaged. And the recovery for boxers is something that we call smell training. It's like exercise for your senses. Basically, what we're recommending is that you take four strong scented candles, things like coffee, lemon, lavender, different scents, strong, familiar scents. And 15 minutes a day, you just take the time, smell them, try to take it in, almost like you're working out. It's just an activity you push through. And over time, anecdotally, we're starting to see that people go from not smelling anything to smelling things just not as well, or introducing phantom smells, to starting to pick up on things smelling better. And it's your brain relearning basically how to smell. The next thing that we get a lot of, before I finish with that, with taste, we have kind of started to see that tasting comes back once the smell comes back. They are very much a paired duo. Because we don't have a great taste training protocol, we've been using the smell protocol. So I always say, even if taste is the bigger issue than smell, do the smell training too, because likely one follows the other. Okay, the next thing is joint pains and muscle aches. So for COVID, the number of people that have said, I had this old rotator cuff injury, it was like 20 years ago, and it was fine, I kind of got over it, and then I got COVID, and it's back with a vengeance. Like, that is a big complaint. Old musculoskeletal injuries are coming back. And a lot of what we're doing right now is treating old musculoskeletal injuries like they're new musculoskeletal injuries. So a lot of it is putting you in physical therapy, giving you the right exercises that you can do on your own to strengthen and support the surrounding musculature, give yourself good form, anti-inflammatories for pain control. There is a role for injections for some arthritic changes, and we do those in the office, using ultrasound guidance. Sometimes there's a role for manual therapy, and we can talk about osteopathic manipulative treatment, which is something that has helped a lot of my patients, particularly with low back pain and chronic neck pain and stuff like that. So it definitely is a thing. Some people say, oh, I think I'm crazy. Like, all of a sudden my knees hurt. And it's true. your body is just recognizing or relearning the fact that you had arthritis in those knees before. Rib discomfort and chest pain. This is a big one. So we get a lot of patients who feel like they're having a heart attack probably 2 to 3 times a day. And without a doubt, the first thing we do is make sure it's not your heart, and we make sure it's not your lungs. So undoubtedly, we're going to set you up with a cardiologist. You're going to get the EKGs, you're going to get the stress test, you're going to get the lab work. We're going to confirm for you that the thing that you think is going to kill you is not going to kill you. It's not your heart. We rule that out. And before, we always want to make sure that, this is, very important. Make sure it's not your heart. But after we make sure it's not your heart, it's not uncommon to get chest wall pain. And what we talk about with the chest wall is your chest rises and falls when you take a breath. If you keep your hand on your chest and take a deep breath in, you will naturally have your chest go in and out. And if you think about how you breathe, when we struggle to breathe because we had COVID and it's in our lungs, your ribs accommodate to create more space for you to breathe. They go in and go out. And so, like any muscle, those muscles can get sore. And so it's not uncommon. I had a patient today actually who said it best. She's like, I climb the flight of steps at work and then I'm exhausted. And I can tolerate the exhaustion, but now I'm sore in the chest and it makes me nervous because I don't know if I'm like, my heart can take it or breathing. And a lot of this is re-education and confidence that, listen, we cleared your heart. We made sure that there was nothing going on there. It is very muscular, and we'll try some manual therapy. We'll try different topical agents, like your Vicks vapor rubs, your Voltaren gels, your topical anti-inflammatories. And if they respond, if the chest pain responds to those, then that gives you a clue. Listen, this is not my heart. This is muscular. We're going to work on this. And part of that is giving yourself the confidence. And that kind of dovetails into this conversation about anxiety and PTSD. I'm someone who deals with disability on a day in, day out basis. And I think what is most frustrating for a lot of my patients is suddenly they feel like they are disabled when they were previously very, very functional. And that is a challenge because it's somewhat of an invisible disability. You can tell by the person who doesn't have a leg that they're disabled, but you can't really tell a long COVID person just by looking at them. You kind of need to know the story. And so sometimes there's a stigma attached to having COVID. There's a stigma to having these ongoing symptoms, these post-acute sequelae of COVID. There's a stigma of getting COVID now, especially currently, when the vaccine is available. There's a lot of different stigmas. There's a lot of different issues. And one of the things that we try to talk about is making sure that you have the support you need. The support group is important and it's available every other Thursday. We have partnered with Christian Healthcare and we're utilizing them as a great resource, both for talk therapy and also for medication management. A lot of times, some of the medications that we use for musculoskeletal pain and fatigue can also be used for mood. And that's something that we can start in the office. But giving, providing recognizing that anxiety related to this disease is a very real thing, and bringing it up to your doctor is important. And the only way that we can address it is to know about it. And so if your doctor hasn't asked you about it, bring it up to them. And that's something that, we can kind of tease out. We talked a couple other things that we should bring up that kind of come across is this autonomic dysfunction or this dizziness. I get a lot of, I went from sitting to standing, or as soon as I get up, it's like I have to grab the wall, I have to grab something. I don't know what's going on. Like every system in your body can be affected by COVID, the heart and your system that pumps the blood when reacting to stressors, your fight or flight response can also be reactive. In the elderly, with age, we know that when an elderly person goes from sitting to standing, the heart takes a little bit longer to catch up, to pump the blood back up to the heart, to make sure there's good blood flow. And sometimes that orthostasis can drop the blood pressure really quickly, and patients can get dizzy and fall. We are seeing that in young people now with COVID. And part of what we're encouraging is to, one, be mindful of that this can happen. Two, to make sure that they're staying well hydrated. You want to make sure there's enough fluid in the vascular system to support the heart working. Being patient with your activities. So knowing that you get up from bed, you sit there, you pause a second, you get your bearings, then you stand up, you pause a second, you get your bearings, and then you go, being cognizant about it. And part of that is also endurance training. We are putting people back into physical therapy, and we were also doing graduated exercise programs. I have one patient, they call it struggle jogging. They know that exercise, they used to be able to run a lot, and it is the worst exercise they've ever done. They have no intention of setting a personal best. They have no intention of setting a record. It's just to get the endurance up. Even if it means you're not setting goals and records, you're not doing your best time. And that's okay. Allowing yourself to kind of get that exercise for the sake of testing your body in an environment that's controlled, so that when you have an uncontrolled experience, a sudden turn, the phone rings and you got to reach, a plate's about to fall, you got to lift and grab, your body is ready for those types of things. And then a lot of the other issues I work on or that come up are related to the team in itself. So, lung issues, I collaborate with our pulmonologists, the long COVID, the COVID pneumonia. We have a number of great pulmonologists here who specifically deal with, what inhalers to use. Should I be on a steroid? Should we be on like a montelukast, a histamine blocking agent, or a mast cell inhibitor, stuff like that. Coagulopathies. There are some patients with COVID who develop blood clots, and we work with our hematologists to make sure, are they on the right blood thinners or not? And if they're on blood thinners, what precautions for safety do we have to talk about? And then the last one, which is kind of a one that no one really likes to talk about, is the bowel issues that come with post-COVID. No one really wants to talk about diarrhea or constipation, but those are real things every single day that impact quality of life. And so, there are different, depending upon the issue, we talk about some of these symptoms. We can start medication.
Dr. Annunziato, I think we're losing you.
Oh, sorry.
Dr. Sharma, can you hear him?
Sorry.
Yes, I can.
One of the last things I was just saying is bowel issues.
Can't seem to hear anybody right now.
Oh, I can totally hear.
Christine, can you take yourself off mute? Can we hear
Everybody's, yeah,
you? No.
everybody's
This
clear
might be
to
the
me.
problem that with Verizon that we're encountering.
Oh no, I'm so sorry. Well, I hope that if people are able to hear, that the last thing we were going to talk about is making sure that your bathroom habits are addressed. And we go with with our Valley's gastroenterology program, and we kind of talk to them about some of the issues that have come up.
We can't seem to hear any of you for some reason. So we're going to give it another couple of minutes, and if we can't get any more vocals in, we're going to have to end the program. So let's give it a couple of minutes. Verizon said this is intermittent. So hopefully in another minute or two, you'll come back on. Okay?
Sure, no problem.
Okay. Actually, we got something in the chat box that other people can hear you. We can't hear you on this side, so please continue, Dr. Annunziato. Sorry about that.
No problem. I was just going to say, and I'll throw it in the chat box. I'll start taking questions. I think at this point, because that's kind of the bulk of the things that what I can do.
Okay, we have one question I had symptoms similar to my bout of COVID after my second vaccination. I was sick in bed for 2 to 3 days with all of the symptoms I originally had. My biggest concern is, should I have the COVID booster shot?
Gotcha. So, one of the things that we need to talk about is the booster, which has been, newly highlighted within the past couple of weeks. Personally, I think that is it's an important thing to get, especially if you're, are either immunocompromised or of age, or as they've said, you're interacting with people where you might be high risk. With regards to your specifically, obviously, have a conversation with your physician first. Make sure that they are aware and understanding. A lot of the counseling that I'm doing with my patients is very individualized for this, because, we do want them to have protection. And also, it's the start of flu season 2, and we want to kind of time it with the flu shot too. And so talk to your doctor. I would not necessarily say don't get it, but I think you need to let your doctor know about it. They might want to check your antibody level first, to see, do we need it? Are you running low? So some people, they time it out, and they try to time it to when they think their antibodies levels have dropped a little bit. The literature is very sparse right now. We've only just got certain recommendations. But I think the fact that you get symptoms when you have the shot is a sign that your body is developing an immune response, and you should take some confidence in that, like, okay, my body is trying to do its job. It's just giving it hell right now, but that is a little bit better than getting the disease itself. And I hope that makes sense.
And I totally agree with Dr. Annunziato that, you're having a conversation with your physician is the right way to go, because the physician knows your medical conditions and your history the best. So, please reach out to your physician and have a conversation about the appropriateness of the booster as it pertains to you as well as your medical condition.
Okay, we have a few more questions. One is regarding gastro issues and possible treatments.
Yeah, so, well, we'll start with constipation. I think that's probably one of the ones that we see a lot. And that's something that we kind of talk about in the office a lot. Very simply, well, there's no way to sugarcoat it. There are medications that make the poop mushy, and there are medications that push. There are mushers and pushers, and it's a poop joke, and it laughs, and it works. But basically what we do is we try to make sure and accommodate, if constipation issue, making sure that there's enough water, and using medications that draw water in to make softer, and then using medications that help push it out and go easily. Talk to your doctor specifically about the thing that is bothering you. If it's a diarrhea component, sometimes there are medications like antidiarrheals over the counter that we use. Your gastroenterologist may start you on a specific medication to kind of limit that too. But there's a lot of pharmacologic agents available, but everything is kind of specific to the patient. I would encourage you to have a conversation.
Okay, we have another question. I had a positive COVID test March 17th. I'm going on 7 months now, and I have not regained my sense of smell and taste. I'm getting very concerned. Is this common? Do I need to worry?
Unfortunately, yes, it is common. I have a number of patients where it's been over a year. Unfortunately, everybody is different, and I've had some patients bounce back super quick. I've had some patients, take a little bit longer to turn the corner. I think the first thing to do is, if it's concerning to you, bring it up to your doctor, make an appointment. And part of any smell issue is also teasing out the other things that may be associated with it. There are some diagnostic imaging that we can get. There's also referrals to ear, nose, and throat doctors that are part of the program that we can send out too. So I think the first thing you do is let the people who take care of you know what's going on, and then we can better address it. It's tough to say, oh, go ahead and do this, but talk to the person that understands you best, which is your doctor, hopefully, and then go from there.
One other question is, who checks antibodies? This is the first time I have heard about it.
So I don't check antibodies, but I've heard that some primary care doctors will go ahead and check the antibodies for patients in specific circumstances. It has
I
to
wanna
a
just
lot to do
respond
with
to her.
patients' particular
Oh, wait,
health
I can
risks.
just type it in now, right?
And so that's why, it's something that, your primary care doctor, which would see you maybe a little more frequently than I would probably be the one taking that responsibility. Yeah.
Another question is, months after positive COVID test, I still have fatigue. Is this normal? I think you addressed this, but maybe you want to go over it again a little bit, Dr. Annunziato?
Sure. Absolutely. Fatigue for several months is very common. Yeah. I had a patient today. She was diagnosed March 2020. She was very early. Fatigue is still her number one complaint. So unfortunately, it is absolutely a thing. Yeah.
Okay. If you have the antibodies, how do you still take the booster shot? Should you still take the booster shot?
So the current recommendations are yes, regardless of your booster level. Yes. I don't think that there is a problem with getting more immunity. And so even if you have an antibody level that gives a little bit of confidence, we're not quite sure. We don't have a great understanding of what these breakthrough cases, how well, if it does break through, like how much immunity is enough immunity. That literature is not there yet. So even if you do have antibodies, the current recommendation is get the booster if it's made available to you, if you're the right age or have the right situations. Yeah.
So while breakthrough, infections are common, the vaccines are doing what they are or what they were intended to do originally, which is reduce the degree of the severity of the illness as well as decrease the hospitalizations. So again, I think having a conversation with your primary care physician or the physician who knows your medical condition the best would be able to give you a better understanding of whether booster is recommended or not.
Okay, we have one final question. Somebody wants to know how long the Care After COVID program has been in place.
So okay, I'm just checking. Can you hear me? It's been going on for a couple of months now,
January. Yeah, we're not planning to stop it.
There's too many people in need, Christine.
Yes, as long as there's a need, we'll take your calls.
I want to
and
thank
set you
everybody
up.
so much. That's the end of the questions. Oh, actually, there's just a couple more that came through. If you have a few more minutes.
Sure.
Have you heard of people getting COVID more than once? I got COVID in 2020 and 2021.
Unfortunately, yes. Sadly, yeah. It's not. I've had probably 3 or 4 of those patients. Yeah. There's nothing more I can say. It's like, yeah, it can happen.
Somebody wants to know a little bit more about the monoclonal antibodies. Help.
So the monoclonal antibodies are available for patients who have been diagnosed with COVID-19. And speak to your primary care provider to see whether you qualify for the monoclonal antibody. And we do have arrangements at Valley to administer the monoclonal antibody. We have a whole program set up. Referrals can be made via your treating physician.
Okay. Another question is, should they receive a booster shot after receiving Regeneron?
So after receiving Regeneron, what was mentioned earlier was that any kind of like antibodies and all of these things, you had to wait like 90 days. So again, having a conversation with your physician who knows your medical condition the best is the way to go.
Okay, who recommends seeing a physiatrist?
I do. No, anybody can refer, and depending upon your insurance company, some insurance require referrals, some don't. But your primary care can put the referral in easy.
I think that is the last question. I want to thank the three of you very much. This was very informative.